Good afternoon or good morning to everyone. Welcome to this pre-recorded webinar. I guess whether it's morning or afternoon will depend on what time you decide to view this. This webinar is in respect of Managed Risk and Multi-Agency Framework, or MARM, as it will be more frequently called. This process, or a version of it, was previously known as RAMP. So if you've been in West Berkshire for a while, that might be the terminology that you are more familiar with. My name is Sue Brain. I'm the Service Manager for Safeguarding Adults in West Berkshire Council, and I will be presenting this short session on the MARM. So this short presentation is about the framework and how it's operationalised in West Berkshire Council areas. This framework for supporting the management of risk has been approved for use by the West Berkshire Safeguarding Adults Board. That board spans the area of West Berks, Reading and Wokingham, and whilst the principles are the same across all three areas, the way it is managed in each area will be slightly different, and this is why each local authority are recording their own individual webinars. So the first thing to say is that we all live with risk every day. We cannot entirely eradicate risk. In fact, it's not always appropriate that we do try and remove all risk from people's lives. But the MARM has a very specific purpose amongst the range of tools available to professionals working in the arena of adult social care. On occasion, you may find yourself working with a client where you consider risk to be exceptionally high, but the strategies put in place to manage that risk have not been effective. This might be because of non-engagement. The MARM framework provides an opportunity in those exceptional cases to review risk, discuss possible new strategies to minimise the risk, or to clearly identify when risk is not manageable. And it's about sharing ideas and sharing risk in a multi-agency setting. The MARM is most likely going to be triggered in exceptional circumstances. The care management and/or safeguarding processes have been exhausted, and yet a seemingly unacceptable level of risk remains, and the likelihood of harm occurring is high. Alternatively, there may be some disagreement between agencies about the management of someone's risk or the perception of the extent of risk. And so the MARM provides a forum in which to discuss and agree a way forward. To ensure we retain the MARM within a lawful process, the individual in question must either be in the care management or safeguarding pathways. The person doesn't need to be in receipt of support services. In fact, that might well be the reason that you wish to refer into the framework in the first place. But we do need to ensure that any MARM discussions are lawful. And for this reason, only local authority employees can request a MARM. If you represent an agency other than the local authority, you should raise your concerns about risk to an individual, either through care management or safeguarding referral routes. If after referring through one of those routes, you remain concerned that the risks either haven't been considered as you feel they should be, then you may escalate that concern to the manager of the safeguarding team. The email address is listed on this slide, and these slides will be made available. Please use this as it provides an audit trail for both you and for us. So if you're a non-local authority employee, you can still request a MARM. So as well as referring an individual through the care management or safeguarding route, you can ask the local authority to consider using the MARM framework. This is relevant where there is already an open case, either in safeguarding or care management, or you're making a new referral to care management and you feel a MARM would be appropriate, perhaps because engagement with your agency has been poor to date, and you perceive that the risks to be significantly high. This slide details how to request that a MARM be considered and the response that you should expect from the local authority. For those staff who work in the local authority, you can make a referral yourself. This slide details the location on the iDrive of all the documents you need when referring into the MARM. You'll be asked to ensure that the care management or safeguarding processes have been exhausted first before making a request. Further, you will be asked to complete the referral form, which is on Appendix B, the checklist, which should have been worked through and completed, and you send both of those forms plus associated documents, for example, recent risk assessments or capacity assessments or support plans, whatever is relevant to that particular case, to the Safeguarding Adults email address, and either the Safeguarding Adult manager or principal social worker will respond to that request. If either of them feel that the existing routes have not been exhausted, they will let you know. So in terms of what will happen once you've requested a MARM, so the MARM meeting will be set up by the Safeguarding Adults team. It can be in any format, so you need to specify any communication needs that would dictate a particular format in advance. You will need to supply all the names and details of the people you think should be present, including contact details for them. Advocacy for the individual, either to support in attendance or to attend on their behalf, will be the responsibility of the referrer. If you're asked for more information, please do send it quickly. As the referrer, you will be asked to present your case, including the perceived risk and what's been done so far to mitigate that risk. We aim to ensure that the meeting is solution-focused and person-centred and isn't just a talking shop. Either the principal social worker or Safeguarding Adults manager will chair. All the minutes, once agreed, should be uploaded onto Care Director, and the review process will be agreed at the meeting. And that's it in a nutshell. It's quite a short and sweet process. If you require any further information or support, the West Berkshire Safeguarding Adults Board has a page that is dedicated to the MARM and can be found at this link. And if you are within the local authority, all the documents that you need are in the iDrive in the location that was detailed on a previous slide. But of course, you can always ask. Okay, I would like to say thank you very much for your time. And that concludes this short webinar.